This is Travis with Stimulus Regenerative Orthobiologics interviewing Dr. Kristen Oliver today. She's going to tell us all things orthobiologics. Kristen, I know you've been doing this almost 20 years. Can you give us a little background of how you got going and your timeline through all that?
Sure. And I can't believe it's been that long. So I started back in about 2006-07, and it was just part of our sports medicine practice, we found patients that weren't really surgical candidates, but had kind of failed all the conservative stuff. They went through therapy, they tried adjustments, all this, and they just weren't healing. So offered biologics way back as an option or an alternative to patients to help them heal a little faster or get something to heal that wasn't healing with normal conservative measures.
And when you're saying that, when somebody says they're not a surgical candidate, what's the difference between that? You're saying so people were looking for a conservative approach. What was the difference with those people as you see through your history there?
Yeah, so a lot of individuals suffer from soft tissue pain. So a partial tendon tear, not a rupture, but a partial inner substance tear, or tendinosis, a chronic inflammation of a tendon. Something that's just not healing, whether it's because of their age, the continued over-exercising, or even just biomechanics. So for some reason, they're not healing like they're supposed to. And those patients are usually not great surgical candidates. A surgeon can sew or repair or tack a full tear. They can, do certain things. But when it comes to a tendinosis or a partial tendon tear or a partial ligament injury, where surgery is really not something that's going to address it successfully, because a surgeon wants to have a good success rate. And if they don't feel like they're going to get that patient where they want to, these are the people who go to PT, they go to rehab, they try all these things, but then all of a sudden they're still having pain. So those are the people that kind of came to see us. They came to us as came to me as the destination of last resort. They tried everything and still had pain. So normal healthy tendon is dense collagen. It's linear, ropey, elastic. And if you cut it open and you look at it, it's all glistening and white and thick. In fact, if I put a needle in a healthy tendon, I can barely inject any fluid. It's so dense and the collagen has so much substance. Well, there's a spectrum. So an acute inflammation, so let's say I'm out pulling weeds and my elbow hurts for a day or two after, or I'm pitching a baseball game in an inning. In a game, I'm pitching an inning and my elbow's a little sore. I ice it, I rest it, I might take some ibuprofen. That's acute inflammation. But what happens is if the tissue just doesn't heal, it sets up this chronic inflammatory condition. And when I went to med school, inflammation was just inflammation. We didn't distinguish between acute, which I like to call red hot on fire, and chronic and smoldering. So think about two different fires. Red hot on fire is way different than chronic smoldering. So the things that help a red hot on fire tendon, rest, ice, bracing, NSAIDs, aren't going to help a chronic inflammatory condition. So a chronic inflammatory tendon, like you're talking about, it actually changes from linear, ropey, elastic collagen to this gray, we like to call it booger tendon. I know it sounds terrible, but that's what it's like. It's this mucinous, sticky tendon that really not only has lost its normal texture and its normal collagen fiber, but then it's lost its normal elasticity and its ability to both concentrically load and isometrically load, and it causes pain. So that's crazy because if you look at a normal tendon versus an abnormal tendon, a normal tendon versus a tendinotic tendon, huge difference. So that's where biologics really started. These people who had chronic overuse injuries of tendons or soft tissue areas that really surgery is not a great option. Surgeons will go in and debride them to try to get blood flow to them, but that only brings about your body's baseline ability to heal something, okay? So if something's not healed, you have to ramp it up and almost give a hyper-healing response. So we found that if you concentrated platelets down into what we call platelet-rich plasma, inject them into the area of injury, you could then promote a hyper-inflammatory, a hyper-healing response that would then get normal tissue to regenerate.
Kristen, what diseases do you feel like or conditions respond the best to PRP with your, what do you say, 28,000 plus patients you've done?
Yeah, there's been quite a few. Yeah, 28,000. It's like 20,000 some and some change. So PRP is best applied to a soft tissue injury that is just not healing or one that you need to have improved quickly. Okay. So soft tissue is a big bucket, right? This includes things like a tendinosis, a partial tendon tear, partial ligament tear, fascia injuries, muscle injuries, nerve entrapment. All of those things kind of fall under that category. So PRP is excellent for those because what you're doing is getting that kind of chronic non-healing area to stimulate its healing. So you repair it and the pain goes away and function returns.
Let's go ahead and go into the bone aspirate. Can you describe what that is and why for like joints and things beyond soft tissue you have more success with that?
Yeah, so the biggest issue comes basic. You kind of go back and go to basic science. The body heals itself by sending platelets to the area of injury through the bloodstream. All right. So as long as I've got an area of injury that once I put the platelets in can attract the stem cells, the other healing molecules, and set up a little healing niche or niche, then you're okay. But areas that have very poor blood flow, you can put the platelets in and they're going to help decrease some of the inflammation perhaps, but they aren't going to lead to any type of regeneration of tissue because there's no blood flow. You can put the platelets there till the cows come home, but they can't stimulate that attraction of everything else you need. So these are primarily intra-articular things, whether it's your knee or your shoulder. Number one. The second thing is disc in your back, very avascular, or even some soft tissue injuries that have been there for a long time. Like let's say you've got a distal Achilles tendinosis and it's just looks awful. It's going to do better if you can put bone marrow concentrate there because it contains not just the platelets that you need for the fertilizer, but it also contains what I like to say, the seeds. So you're getting both there without having to rely upon the bloodstream. So platelet-rich plasma relies upon the bloodstream to attract everything else there. In those places that are avascular or don't have good blood flow, you have to put the platelets there and you have to put the stem cells there.
And so what is in the bone marrow aspirate? What is the magic that you're getting in there?
There's a plethora of things. So when we take peripheral bone marrow, it's just like when we take blood. We put it in an FDA-approved device to concentrate the bone marrow. So it's not just fresh harvested bone marrow, it's concentrated bone marrow. And we're looking for the layer that contains the platelets, the stem cells, and multiple other little molecules. One of which we found is key and probably more important than the stem cells is something called IRAP, IRAP, which stands for interleukin receptor antagonist protein, which is this big word, but what it basically is when you have a joint that's suffering from chronic inflammation, there's a whole bunch of like cytokines and chemokines, all these little pissed off molecules. I like to talk them like Pac-Man. There's all these little Pac-Men in there, and these little Pac-Men then attach to receptors on the cartilage, which cause more Pac-Men to get released, which eat more cartilage. So it's this kind of self-propelling or snowball going down the hill type reaction. That's why someone can have arthritis, and it can get worse even though they're really not doing anything. So IRAP, which is in bone marrow concentrate, basically is a molecule that attaches to the receptor the Pac-Man attached to, and then the Pac-Man can't do anything. They just bounce off it. And so it sort of gets rid of that chronic inflammatory condition. So bone marrow concentrate is this just great combination of both, I like to say, seeds and fertilizer so that you can mitigate chronic inflammation and pain. So it's not, we all like to talk about it being the stem cell because, everyone talks about stem cells and they're a vital part of this, but they're just a part of it.